Good morning. I'm Clarice Camintel, the student nurse of Riverside College. So today I will be performing the 4 procedures: the infant bath, the cord care, feeding, and burping. So today I will proceed to the first procedure, which is the infant bath. It is to clean and refresh the infant, to stimulate circulation, to promote comfort, to develop sense of security, um, to remove secretions and excretions, and lastly is to allow inspection of the body for skin breakdown. So before I start, I will wash my hands to avoid cross-contamination. So after that, I will gather all the equipments needed to save time, energy, and effort. So before tapaliguan si baby, i-check tagid iyang axilla temperature, if normal or hindi. I-check ta ang axilla sa baby sa left and right. So the temperature of baby is normal, 36.7. So pwede siya natin mapaliguan. So I will undress the baby and wrap the baby using mummified restraint. It is to prevent unnecessary movements while ginapaliguan si baby. Next, I will carry the baby in a football hold manner. It is to prevent the baby from falling. So, ang one arm with the buttocks of the baby nakarest sa aton nga crook of the elbow. And ang palm sa aton nga hand nakasupport sa back of the neck and head of the baby. And ang thumb and middle finger naka-clip sa both ears ng baby para hindi masudlan sang tubig kung inapaliguan. And take note if the baby na first batch after delivery ang unahon siya paligo bason is ang iyang face and if second batch yan na or kapila na siya makapaligo head na ang iyang unahon. But before that, i-check na ang temperature sa water if nang tamaan siya katugnaw or kainit para kay baby. So mag-check sa water temperature ang aton gamiton na sa aton ni elbow. So, normal lang siya. Hindi siya taman katugnaw or hindi man siya taman kainit. So, kaya mo na yung first bath after delivery sa baby. So, I will wash first ang face ng baby. Masugod ko sa aya, farther side from inner canthus to outer canthus. And the face, CSC motion. Using CSC motion. Next, sa iyang near side, from inner canthus to outer canthus. And CSC motion sa iyang face. After that, i-wipe ta ang face ng baby to prevent the baby from chilling. Sa iyang face is pa to dry. And after that, ma-wash siya sa iyang head. Tapos into your head, some water. Next, ma-use ta sang mild soap or mild lang shampoo to prevent harmful effect on the skin of the baby. Mag-apply ta sang shampoo sa iya head nang i-massage siya lang thoroughly in a circular motion. Next, i-rinse ta. Dapat i-rinse kid mayo para to avoid skin irritation and infection. And dries the head in a circular manner. Next, I will place the baby in the crib and remove the diaper. tell si baby na wala naman siya diaper, pick up ko siya and bring to the sink. Kag, pag-akwat kay baby, ang baby's head and neck supported by the palm of the hand, and baby made to sit in the sink lined with the baby's layet. And pungkuon si baby. And i-wet na iya entire body starting from the farther arm, chest, and abdomen to the nearer side. Nearer side. And butangan tas ang habon. Yung chest down to her abdomen, the near side, sa chest down to her abdomen. But make sure nga iyang axilla is na iloan mo. Next, after ta nga ihabunan si baby, ibanlawan ta siya from the neck to the entire anterior portion of the body. Sa neck yan. And turn the baby in a prone position. So, magano sa prone position, ang aton nga hand, naka-hold sa baby's axilla, and naka-support ang aton nga forearm sa iyang chest. And amo na siya aton nga free hand na mag-use sa paghabon kay pagbanlaw sa bata. Next, wet the entire back portion of the baby's body. And soap from the nape of the neck to the posterior aspect of the baby's body. So, yan ano. Next, ang back portion naman using the circular motion. So, using circular motion in applying soap at the back, it is to circulate the blood of the baby and gives warmth to the baby's body. So, excuse me. Next, I will soap the further lower extremities. Mapay attention sa popliteal area or sa likod ng tuhod sa baby. Sa near side. After that, ang last nga mahabunan kag matinloan is ang buttocks and the genital area. So, may use ta sang correct direction in cleaning the genital portion. Ma-follow lang ta sa cleaning principle from cleanest to dirtiest, and to prevent contaminating sa area sa genital. So, ma-start ta sa genital, outside sa buttocks. Make sure talangan natin loan mayo para wala sang bilin yung higko. Next, i-rinse thoroughly the entire posterior portion of the baby's body. Kag after that, nga banlawan ang likod sa bata, balik na siya sa supine position para mabanlawan ang sa anterior position, portion sang body sa baby. Make sure lang ang neck and head nakasupport ang job ko. Sa posterior and anterior. After mabanlawan, i-place sa baby sa crib and pat to dry using the new baby's layet and dress ang baby. But before nga mag-dress ang baby, make sure nga ang baby nga dry mayo para hindi siya mabugnawan. And after na, i-dress si baby with a new shirt or dress and apply new diaper and comb na ang hair sa baby. And after sa infant bath, ma-proceed ko sa cord care. It is to promote drying and healing of the cord and to prevent infection and the foul odor, and especially to provide comfort sa baby. But before ta mag-start sa ato nga cord care, wash hands to prevent, to avoid cross-contamination. And I gather all the equipments needed to save time, energy, and effort. So the alcohol, sterile cotton buds, and medicine tap. So I will expose the umbilical stump of the baby. And cover genitalia or circumcised area with the baby's layer. It is to prevent dripping of solution into the genitalia or circumcision stump to prevent discomfort. Next, I will drop 70% of isopropyl or refined alcohol to the baby's umbilical cord. It is to soften the dried blood, to soften dried blood and promotes easily removal. Next, I will soak the sterile cotton bud or jet into the 70% isopropyl alcohol. Why sterile cotton jet or sterile cotton buds? Para ang ginagamit para magtinlo sa pusod sa bata is para hapos lang siya pag hindi siya tandog permi. So clean the umbilicus with sterile cotton jet in circular motion or rotary motion from inner to outer portion of the cord. Like this. It is to prevent infection and i-discard ang used ng cotton buds and make sure lang natinluan mayo ang pusod sa bata. Next, I will drop 70% ibuprofen to the umbilicus by avoiding dripping of solution to the genitalia or circumcision area. It is to prevent irritation. So I will dry the umbilical cord by open dressing. It is to facilitate drying and healing. And remove the cord clamp after 48 hours. And do aftercare. Next, I will proceed to the feeding and burping. So, in infant feeding, it is to supply infant's nourishment and fluid to meet the baby's total needs. So, before that, I will prepare the needed equipment, alcohol, and feeding bottle and bottle cap. Next, I will wash my hands thoroughly with soap and water to prevent cross-contamination. But before feeding sa baby, i-check ang infant's name in the wristlet or anklet and also at the bottle before giving the infant his or her feeding. A mistake in the formula may be as dangerous as a mistake in the giving of medications. Next, I will wrap the infant warmly and hold him or her in a slight fowler's position. Positioning the infant aids in easy swallowing. So the baby is already in the semi-fowler's position. So place the entire nipple in the infant's mouth, but before nga ibutang ta sa mouth sa bata, make sure nga wala na sang hangin nga nabilin sa nipple sang bottle. Discomfort will occur due to the swallowing of air. Place an extra diaper on your lap under the infant's buttocks. It is to avoid soiling uniform as a result to the gastrocolic reflex stimulated by feeding. So, after feeding, I proceed sa burping sa baby. So, I will use the upright position technique. I will place a small towel over the shoulder. Hold the baby upright against the shoulder, supporting the head. Gently pats or rubs the baby's back. So, after that, position the baby in the right side, lying inside the crib. So, the baby is already inside the crib. Placing the baby in the right side position para maging comfortable si baby. And after that, do aftercare of the equipments and wash hands to avoid cross-contamination. Thank you!